I am Erica Johansen. I am an account supervisor at Splash Media, and I am the Great Chalupa, founder of the HITsm community. So HITsm started in 2010. It was a part of the digital strategy for my former company, CorePoint Health. And we started the community because we felt at the time, with the way that social was evolving and really getting started, that there was a lacking of healthcare IT voices in the conversation. So our goal was to create a community of people or provide a venue for them online where they could actually talk amongst one another and build each other up to better the future of the healthcare IT space. It's definitely surpassed my expectations. I wasn't sure what to expect when we started it, except I felt like there was this void. It's like we need to create a space for these people. But what I didn't anticipate was the communal aspects and the power of the community that came with that space. Folks really have turned it into something much bigger than I ever anticipated, because they're all building each other up, and at the end of the day, they're furthering the mission of healthcare technology. I'd love to see the community continue to collaborate with one another and work together and empower each other to be better professionals, better leaders. I think it's been a birthplace for a lot of the key thought leaders in the health IT industry today. It's bolstered the success of a handful of folks that are now keynote speakers at some of the leading industry events in healthcare technology. I'd love to see it to continue on that path. I want to see it be a platform for people to try new ideas, to gain feedback and consensus among other leaders in the industry, those that are educated on the nuances that healthcare IT needs to consider in its strategy, and really further the mission of healthcare technology at the end of the day. And that's improving the patient experience through technology and all the points that happen along the patient journey. So in 2016, it was the first year where the average individual deductible was greater than the average individual spend for healthcare. That's a really important statistic, because that means that the consumer was now facing the brunt of healthcare costs. So healthcare in general as a whole is undergoing this really interesting transformation from what was a traditional B2B space and is now evolving to becoming B2C. Your consumer is now on the hook for most of the healthcare costs. So patients have always had an important role in the conversation. They're the ones that are receiving the services, they're the ones that are advocating on behalf of the services. But I see the future of HITsm including more and more of those patient voices, so that patients, physicians, the IT professionals, the communications professionals can all collaborate together to improve the patient experience end to end. I love HITsm. It's a very special part of my, it was a very memorable experience for me being able to found a community as dynamic as HITsm is today. And I'm encouraged just watching all the conversations day to day, and I'm excited about the future of what's to come for that community and the leaders that will emerge from that space.